All are related to the lateral vaginal fornix except inferior vesical artery. The structures related to lateral vaginal fornix are ureter, McEnroe's ligament, and uterine artery. Para-ovarian cysts are derived from Wolffian duct. The epithelial lining of cervical canal is high columnar. Bartholin's duct open into groove between labia minora and hymen. False about vagina is that it is rich in glands, and true about vagina is partly or wholly derived from urogenital sinus lined by stratified squamous epithelium, posterior fornix lengthier than anterior fornix. Epithelial lining of Bartholin's duct is columnar. Venous drainage of upper part of uterus and placenta is through ovarian vein. Clitoris develops from genital tubercle. Scrotum is analogous to labia majora. Which of the following is Schiller positive? None. Lymphatics from clitoris drain into deep inguinal lymph nodes and lymph node of Cloquet. Ovary developed from genital ridge. Transverse vaginal septum corresponds to external os. True about isthmus are all except. So what is true is that it forms the lower uterine segment. Mucosa is similar to endometrium, present between cervical mucosa and endometrial mucosa. Which of the following conditions is commonly encountered in the female newborn and usually requires no therapy? Mucoid vaginal discharge. Size of Graafian follicle is 2 mm. The shape of an nulliparous cervix is circular. Bartholin's glands corresponds to paraurethral glands. The following artery is not a branch of the anterior division of internal iliac artery. So iliolumbar is not a branch, but the branches of anterior division of internal iliac artery are uterine, internal pudendal, and vaginal. Before puberty, what is the ratio between the cervical length and uterine body? 2:1. During the development of female genital organs, Bartholin's gland develops from urogenital sinus. Main support of the uterus is formed by McEnroe's ligament. Cervix to body ratio in a prepubertal girl is 2:1. Cortex of ovary contains all except. So cortex of ovary contains corpus luteum, primordial germ cells, and Graafian follicle. It does not contain hilus cells. The ovulatory period corresponds to 14 days before menstruation. Gonadotropin is a glycoprotein. Maximum function of corpus luteum occurs 9 days after ovulation. The probable source of relaxin is ovary. Gonadotropins are glycoproteins. Ovulation occurs 14 days before next menstruation. In the absence of fertilization and implantation, the corpus luteum persists for 12 to 14 days. False statement regarding hormone status in menopausal women is decreased FSH. So the true is increased LH, decreased estrogen, and decreased progesterone. FSH secretion is stimulated by LHRH. LH surge precedes ovulation by 24 hours. Corpus luteum functions maximally without an implantation for 9 days. Hot flushes in postmenopausal women are best treated with which of the following? Estrogen. Average age range of attaining menopause is 45 to 55. Cornification index is maximum in late proliferative phase. Endometrial biopsy is done in which phase of menstrual cycle? 22 to 24 days. Sertoli cells have receptor for follicle stimulating hormone. Inhibin inhibits the secretion of which hormone? FSH. Primary oocyte remains in the ovary in which stage? Prophase. In a young female of reproductive age with regular menstrual cycles of 28 days, ovulation occurs around 14th day of periods. When is the first polar body extruded, accompanied by ovulation? After how many days of ovulation, embryo implantation occurs? 7 to 9 days. The sensitivity of the uterine musculature is enhanced by estrogen and inhibited by progesterone. In those mammals which are seasonal breeder, the females are receptive only once a year. This cycle is termed as estrus. Corkscrew shaped endometrial glands is seen in late secretory phase. Following are the features of inhibin except. So what are the features? Non-steroidal water-soluble protein secreted by Graafian follicle. Increased secretion of inhibin occurs in polycystic ovarian disease. And the false about feature of inhibin is that stimulates FSH secretion. It does not stimulate FSH secretion. Source of progesterone during normal menstrual cycle, corpus luteum. The best predictor of ovulation is onset of the LH surge. Which of the following is the earliest change in the endometrium after ovulation? Subnuclear vacuolation. Ovary secretes estrogen, progesterone, testosterone, and androgens. Ovulation occurs before 14 days of menstruation. Endometrial biopsy is done at premenstrual phase. Naturally occurring estrogen are estrone, estriol, estradiol. Characteristics of the fertile phase of the menstrual cycle include all of the following except. So the characteristic of the fertile phase are peak levels of estrogen, clear abundant cervical mucus, and ovulation. Which is not a characteristic of the fertile phase of menstrual cycle is production of progesterone. The fawn pattern of cervical mucus seen in the first half of menstrual cycle is because of low sodium chloride level. After how many hours of LH surge does the ovulation occur? 24 to 36 hours. True about HCG is that prevent involution of corpus luteum. True statement regarding oogenesis is or are primary oocyte arrest in prophase of first meiotic division, secondary oocyte arrest in metaphase of second meiotic division, first polar body is extruded during first meiotic division of primary oocyte. True statement regarding implantation that it takes place in blastocyst stage occur on 5th day after ovulation. True about HCG is that it is a subunit identical to LH, FSH and TSH. Maximum level seen at 60 to 70 days of gestation, detected in serum and urine 8 to 9 days after ovulation. Which of the following is seen in the ovulatory phase? Stimulation of continuation of reduction division of oocyte. The peak level of serum LH in nanogram per milliliter required for ovulation is 75 nanogram per liter. During a normal pregnancy, the changes occurring in the urinary tract include the following except. So which are the changes? Increase in the glomerular filtration rate, that is GFR, dilatation of the uterus, elevation and thickening of the trigone. So which is not a change is that hypertonicity of the ureteric smooth muscle. Fertilization occurs in ampulla. Pap smear is taken from the nun. Ultrasound is diagnostic in fibroid uterus. All of the following are indications of doing a pap smear except. So which are the indication of doing a pap smear? More than 40 years of age, pregnant female, sexually active female. Menorrhagia is not an indication of doing a pap smear. What percentage of postmenopausal ovaries are identified on transvaginal ultrasonography? 100%. Hysteroscopy can diagnose all except. So hysteroscopy can diagnose Asherman syndrome, septate uterus, adenomyosis and TB endometritis. The colposcopic features suggestive of malignancy are except. So the colposcopic features suggestive of malignancy are vascular atypia, punctuation and white epithelium. Condyloma is not a feature suggestive of malignancy. Evaluation of a patient with postmenopausal bleeding done by pap smear, endometrial biopsy and dilatation and curettage. Hysteroscopy means visualization of uterine cavity. The investigation of choice in a 55-year-old postmenopausal woman who has presented with postmenopausal bleeding is fractional curettage. Which of the following are distension media used in hysteroscopy? Carbon dioxide, glycine and dextrose. Following are the indications for hysterosalpingography except. So the indication of hysterosalpingography is infertility, recurrent abortions and abnormal uterine bleeding. Pelvic infection is not an indication for hysterosalpingography. To diagnose uterus diadelphys, procedure of choice is hysterosalpingography. Ideal age for repair of vaginal agenesis is before marriage. Biconvate uterus is due to incomplete fusion of mesonephric duct. Cochleate uterus is acute anteflexion. Raloxifene can cause breast carcinoma. Complete failure of Mullerian duct fusion will result in uterus diadelphys. The most important indication for surgical repair of a biconvate uterus is habitual abortion. Diethyl stiboestrol causes the following defect except, so it causes T-shaped uterus, vaginal adenosis. It does not cause renal anomalies and perifemoral cyst. In complete Mullerian duct aplasia, all of the following are likely to be absent except, so in complete Mullerian duct aplasia, fallopian tubes, uterus and vagina is absent while ovaries are present. Which of the following condition present with absence of both Mullerian and Wolffian duct structures? Androgen insensitivity syndrome. Turner syndrome is associated with chromosome 45. The chromosomal complement in persons with Klinefelter syndrome is 47XXY. Bare body is seen in Klinefelter syndrome. All are seen in testicular feminization syndrome except, so what is seen is 46XY, primary amenorrhea, vagina may present. Short stature is not seen in testicular feminization syndrome. During sexual differentiation in males, primitive gonads differentiate into testes due to the presence of SRY gene. A 15-year-old female presents with primary amenorrhea. Her breasts are Tanner 4, but she has no axillary or pubic hair. The most likely diagnosis is testicular feminization syndrome. The treatment for a case of viralizing adrenal hyperplasia is cortisone. Features of Turner syndrome is or are except Feature of Turner syndrome is genotype XO, infertility, streak ovary, and coarctation of aorta. Gonadal sex of the fetus is determined by sex determining region on the Y chromosome. Which of the following is used for hirsutism in female except, so which is used is spironolactone, finasteride and flutamide. Oxynardrolone is not used. In an adult phenotypic female, absence of uterus suggests the diagnosis of which one of the following? Mayer-Rokitansky-Kuster-Hauser syndrome. The first sign of puberty in girls is breast budding. All of the following statements about androgen insensitivity syndrome are true except, so what is true for androgen insensitivity syndrome is patient have an XY genotype, short vagina may be present, ovaries are absent. What is not true is that pubic hair are abundant. Pubic hair are not abundant in androgen insensitivity syndrome.